Delisting OHIP services, well, it's not exactly popular. People understandably don't like paying out of their own pocket for things that used to be covered by the province's health insurance plan. With us now for some historical perspective on disputes, such as the current one with the optometrists, we're joined from Guelph, Ontario by Carly Weeks. She's a health reporter for the Globe and Mail, and we're delighted to welcome her back to our airwaves. Carly, how are you managing these days?
Can't complain. We have a nice roof over our heads. Everyone's doing well and we're healthy.
Glad to hear that. Now, you just listened to the two different interviews that we just did with the head of the Optometrists Association as well as the junior health minister. Are you able to come to a conclusion based on your coverage of this issue and what you just heard from the two of them as to which side is closer to the angels on this issue?
Yeah, asking me to be mediator is obviously putting me in a tough position. But having been a health reporter for a number of years, I can say that I think that there's some valid points on either side. What we are seeing here is a major impasse after sort of years of underfunding. I think we can agree that optometrists have been sort of underfunded when it comes to the OHIP insured services. Disputing all of the numbers and everything, I'll leave that to the bargaining table. But on the government side, costs are rising, things are sort of escalating. And we can all see with the COVID crisis and everything that's been going on, the current levels of spending aren't sustainable. I'm not sure what the solution is here. I don't think that, shutting a lot of people out of getting appointments for an extended period of time is going to be benefiting anyone in the long term. I'm sure we can all agree on that. But I think really what the issue is here is that there are some fundamental problems with the way we've been funding and approaching things like vision care for many years. And it's just sort of one example of how our universal system really isn't that, and that vision care is kind of left to the individual to sort of figure out on their own, which means that a lot of low-income people often get shut out.
I'm going to come back to that in a second, but if there's one thing both sides in this dispute agree on, it's that it's not all the fault of the current government, that this is a circumstance that basically developed over nearly 3 decades. Do you have any idea as to why successive governments over the years have sort of allowed this to fester to the point now where a withdrawal of services has been contemplated?
Yeah, obviously, and no one wanted to see this. This is a rather dire situation for those who kind of haven't been paying attention. This is really serious. So if you do look back historically, things have been sort of been withered away when it comes to things like vision care in the province of Ontario for a number of years. Obviously, the most significant date in the last couple of decades was in 2004, when vision services for most Ontarians were delisted. So until that point, most people could go and get an eye exam covered, sort of a once a year kind of thing. And after that point, it was a very significant moment when things were delisted. And from then on, that's how we entered into this current situation where the province does pay for, they do cover things for people who are young, people who are old, and people with certain eye conditions. But basically, the 2004 mark kind of signified this moment when vision care really kind of, from the province's perspective, I guess, really ended for most Ontarians. And then it was left up to private insurance and people to pay out of pocket. This kind of thing has been going on across Canada, and it has been going on for a long, long time. Kind of the elimination of services, the delisting of services, it's been going on for a number of years, many, many years, and it extends to other things other than vision care, dental care and things like that. They were seen as sort of an individual's responsibility, I think, for many decades, that it's up to the individual to sort of figure out how to brush their teeth and take care of their eyes. Thinking has changed, and I think for the better in a lot of ways. And there's now a greater recognition and a greater push toward recognizing that things like vision care, things like dental care are really part of a person's whole health. And so a person who's maybe a low income and can't pay out of pocket, their kid doesn't necessarily have to go to school without being able to properly see, or the elderly person who doesn't qualify yet for the over 65 coverage. Are they getting those exams to make sure that conditions like glaucoma are being caught in time? I guess my overall point is that for the longest time, we've allowed these kinds of health conditions to be pushed onto the back burner by saying, well, these aren't really the government's responsibility. It's up to the individual person. And I think that evidence is showing us that's not really the case. These are part of health and they need to be treated as such. What the government does next and what optometrists do next I think that's the difficult question we face now.
Sure. Well, I well remember back in 2004, it was the Dalton McGuinty government that delisted these services, and they did so simply as a cash saving measure. They saved hundreds of millions of dollars by delisting these services and declining further coverage on them. Do you think, though? I mean, here we are 17 years later, and we've seen the consequences of that decision. Do you think inside healthcare attitudes on this have changed, and that there is now perhaps a greater push to include, as part of OHIP insured services, vision and dental?
Definitely. There has definitely been a change. And I've even seen it through the course of my career. I started out, I remember, as an intern covering the 2004 announcement, and what a significant day that was. And really since then, what the attitude has changed from, well, if you need glasses, then that's too bad. You'll have to pay for that, or, if you don't have insurance. To really an attitude now where there are federal parties like the NDP just campaigned on getting universal dental coverage included for all Canadians. There's been this greater recognition and a greater push toward recognizing that people who are low income shouldn't be punished because they can't afford to pay for some of these services. And while it is true that a lot of these services get paid, they're covered by provinces if you're in sort of the lowest income bracket, there's a number of people who are sort of what we call, people who are referred to often as the working poor. So they have a job, but they still don't qualify for these benefits or programs. And so themselves and their children go without. When we think about things like dental and vision care, they're not just about being able to see or having clean teeth. This is about, long-term health problems that can impact people. So if you're not having regular eye exams, and, you could be developing a serious eye disease that goes unrecognized, and that does eventually cause blindness. So things like glaucoma, for instance, that's a very common eye condition that you do need to have monitored and tracked. And if you go for regular appointments, your eye doctor will recognize it and say, okay, we need to start you on a course of treatment before it gets any worse. Same thing with dental care. And we now know, and there's been so much more evidence that's come out in the last decade linking poor oral health to things like heart disease and other forms of very serious chronic health conditions. So the immediate savings for the government are, of course, lucrative, and the government is cash strapped, and we don't have all the money in the world to pay for everything. But on the flip side, the long-term costs of ignoring these things and letting these problems fester, and then people ending up in the hospital or ending up with things like, blindness. Not only is it a massive cost in terms of to the healthcare system, and there are estimates that it's, in terms of billions of dollars in healthcare costs, which I think can be disputed or talked about. The cost to the individual is also massive. So there are a number of people who are experiencing vision loss and blindness because they simply were not able to afford those yearly exams and checkups and monitoring. And plenty of research has shown that in the years since the delisting happened, the number of eye diseases that have been diagnosed has dropped. That doesn't mean people stopped having eye diseases. It means they're just not being diagnosed as frequently anymore.
Well, if admittedly, this is a bit of an unfair question to put to you, because you probably don't have the numbers at your fingertips, but you probably can make a comment about the fact that if optometrists are not seeing patients in their office and they're telling them to go get checked out in the emergency department, which is, to be sure, a more expensive setting, and presumably it takes longer to get in to see somebody there. Therefore, when you present, your circumstances are going to be worse than they might otherwise have been had you got faster treatment. I mean, surely that all costs a healthcare system at the end of the day a lot more. So how are we ahead?
Definitely. And I think that the optometrists here realize that, if you're going to send a patient to an emergency room or to a family doctor, most likely in a lot of cases, they will end up being turned away because, family doctors aren't set up to give proper eye exams or other kinds of treatments for those kinds of conditions that they might be referred to right now. So I think the real loss right now and the real dire situation are the ones facing those families that are currently being turned away, and the ones who are being told, even though you don't have OHIP, you don't have the option to pay out of pocket right now because of this impasse with the government. So there are people who are really suffering as a result of this right now. Hopefully this is a temporary situation, but it can't go on much longer because and then I think that's why, obviously the optometrists realize there is a lot of pressure on the government to make a move here and hopefully to resolve this in a way that everyone can agree on, because really it's the most vulnerable people who are suffering right now as a result of this, and these are the same people that have been suffering throughout the pandemic. People that referred to as, the working poor, people who are lower income, often people who are racialized. These are the people that need as much help as they can get, and this puts them at an even greater disadvantage.
Carly, in our last 20 seconds, how do you figure this thing ends?
I think that they will go back to the bargaining table. I can't imagine the optometrists or the government will either will get everything that they want in the end. I think that if I could make one plug, it's for the fact that we need to rethink how we fund these things, and a cost saving up front, is not really a cost saving if you're going to be spending triple that in the long run. We need to think about things like vision and dental care as part of the whole health package and rethink how we pay for a lot of these services.
Gotcha. Carly Weeks, health reporter for the Globe and Mail. It's great to have you on TVO again. Hang in there, okay?
You too. Thanks, Steve.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.